So before, when we had the paper charts, you would have to pull your charts for the day of your patients that were coming in. You kept a schedule. Of course, it was still in the computer, but it wasn't as patient-friendly as it is now. You would get your list of charts that was coming in for the day. If those patients canceled, then you had to put the chart back. The patients had paperwork, papers to fill out, signatures, clinic consents. After that, we'd have to put holes in it. We'd put it back in the chart. As far as it being handwritten, sometimes it was very hard to read. We'd have to check that chart every time that patient come in. Is that consent due? Is their protected privacy paper due? What are we seeing this patient for? So you had to review the chart as far as pulling it. If you were a nurse practitioner or if you were a provider, you would have to look at that chart. Oh, this patient, figure out what this patient's coming in for. You may have to flip back 3 or 4 different pages, to find out what this patient had been seen for or had the lab work that had been done. So it was less convenience than it is now. Patients love the iPad signatures. And this is the reason why. They don't have to flip through the pages. They are, and even the elderly even love this because they're not having to sit down and go into rigorous, paperwork that they have to sign and then having to bring it back up to the girls in the front. And, the e-access forms are great because my front office staff do not have to scan those into the chart. And so that saves time for them. It saves time of, okay, did we scan this in the correct chart? Because they go automatically into that chart.